Hello, everyone. Thank you very much for your interest in our presentation titled Minority Within Minority, Examining the Effects of Multiple Discrimination and Protective Factors. My name is Chiaki Konishi. I am an associate professor in the Department of Educational and Counseling Psychology at McGill University in Canada. I am very excited to share our research findings using this opportunity. I appreciate the World Anti-Bullying Forum team having us as part of this conference. So, when concerning a topic of the discrimination, which is our primary focus in this study, stigma is an important term. Stigma is generally considered an attribute that sets an individual or group apart from the rest of the society, or the normalized social order. Despite the variations of definitions of the stigma across disciplines, the process commonly involves discrimination against the stigmatized individual or group that often results in a discriminatory behavior. Generally, when the concept is defined, a number of the authors, including myself, quote Goffman's definition of stigma, spoiled identity, reflecting a social attitude that is deeply discrediting and reduces the processor from the whole and usual person to a tainted and discounted one. So, in addition to labeling and stereotyping, active discrimination and the misuse of the power, the most damaging aspects of stigma. Both racial or ethnic minorities and sexual minorities are frequent targets of stigmatization through racism and homophobia. Unfortunately, there's no question that such discrimination is pervasive in schools and that both racism and homophobia are associated with a number of the negative effects on physical and mental health. However, limited attention has been given to how these forms of the discrimination, racism, and homophobia together might affect individuals, especially in schools. Similarly, although there is evidence of the role of the peer support as a protective factor for distress, not enough consideration has been given to the support from adults, especially in the context of the multiple forms of discrimination. Therefore, this study investigated the relationship between the experiences of the multiple forms of discrimination at school, racism and homophobia, and school-related outcomes such as skipping classes, sense of school belonging. Also drawing from research on resilience, another goal of the present study was to explore whether having support from adults at home or at school serves as a protective factor that reduces the risk of high levels of distress among students experiencing multiple forms of discrimination. So our data came from student surveys in Western Canada, including nearly 50,000 students in high schools. You see a term BIPOC, B-I-P-O-C, at the bottom of this slide. BIPOC here refers to Black, Indigenous, and people of color. Following the guidelines provided by the Society for Research on Adolescence in North America, we recognize that BIPOC is a newer term in the field of adolescent development with a longer history. So we are using this term to be inclusive of different racial or ethnic groups. We have used the following analytical approaches in our study. LCA allows us to capture the intersections between multiple and overlapping experiences of the different types of discrimination. So in this case, racism and homophobia, by identifying subgroups or subcategories of individuals based on their response patterns to multiple indicators in the questionnaires. Multinomial regression was also performed to examine the association between the LCA membership and the school-related outcomes. Finally, moderation model was tested to explore the role of adult support on the relationship between the LCA membership and our target outcomes. Our study included these measures presented in the table to assess the relevant variables, including discrimination, school-related outcomes, and adult support. So first, let's see the prevalence of the racial discrimination and sexual orientation discrimination among students at school. A number of students reported their experiences of being discriminated against due to racial background. And so over 36% of the students, or sexual orientation, over 40% of the students at least once or a few times a year. Of interest was, based on these types of discrimination, how we could identify a specific membership among our students. We identified the 4 groups presented in the table, including low discrimination, which had the highest portion of the students, racial discrimination, sexual orientation discrimination, and multiple discrimination groups or classes. Of interest was whether these classes were associated with higher or lower levels of school-related outcomes. As seen in the table, adolescents in a multiple discrimination class were at greatest risk for all school-related programs. So look at the right side of the table and focus on the OR column. OR refers to odds ratio. The students in a multiple discrimination class were more likely than low discrimination students to report lower sense of the safety, so represented by the value 0.21 or only 1/5 as compared to low discrimination students. Lower sense of the belonging at school and a low self-esteem. Also, they reported more skipping classes. So value 3 next to skipping classes tells us 3 times higher than low discrimination students. Another goal of the present study was to explore whether having support from adults at home or at school serves as a protective factor that reduces the risk of the high levels of distress, such as low sense of safety and belonging at school and self-esteem, as well as skipping classes among students experiencing discrimination, especially multiple forms of discrimination. So our results reveals that adolescents with high levels of adult support from family or from school are more likely to have higher sense of safety and belonging at school and self-esteem. This pattern was most evident for the multiple discrimination class. Also, those students having high levels of adult support at school or at home were less likely to skip classes, except for the students in the sexual orientation discrimination class in relation to adult support at school. So now, some of you might want to see a visual presentation of this finding. Also, I'm a very visual person too. So here, the visual presentations of the moderation effects in a multiple discrimination class. First, let's see school safety. We created 3 different groups of the students depending on the levels of support that students received from adults. The blue line represents the low adult support group. The red line is about the medium adult support group. And the green line represents the high adult support group. The buffering effect of the adult support, was clear for both family and school environments. Especially the high levels of adult support clearly served as a protective factor contributing to greater sense of school safety among students experiencing multiple forms of discrimination. The similar pattern was observed for school belonging, also for self-esteem. The buffering effect of the adult support was also very clear for skipping class or skipping school. We clearly see the interaction for the low and the high adult support groups. As you might recall, in terms of the non-significant results on the buffering effect of the adult support at school among the students in the sexual orientation discrimination class in relation to skipping school, as seen in this figure, we can still observe the interaction for the low blue line and the high and the green line adult support groups, although the interaction was not statistically significant. However, I still wanted to highlight the interaction here. So, to summarize, although discrimination, particularly racism and homophobia, is pervasive in schools, the issue of the discrimination is still considerably absent from school policies or programs such as safe school policies and public discussion. The findings from this study show the pernicious impact of discrimination, especially multiple forms of discrimination, on adolescents' school life. And it urges us as adults to better address and further integrate the issue of discrimination in schools. The importance of examining the forms of discrimination, so in this study, racism and homophobia, and the significant role of adult support, both from school and the families, should be highlighted as important messages from the present study. Of course, we do acknowledge the following limitations in our study. The present study was still correlational and based solely on student self-reports. As a future direction, a longitudinal study is ideal to test our hypothetical directionalities of the relationships. Nonetheless, I still believe that our study was of significance for families, teachers, and school administrators, as well as policymakers interested in dealing with issues around multiple discrimination at school and the potential benefits of adult support, both from family and school. We all hear and see and feel an event as part of our usual life, but not necessarily that we are always actively taking action. We are all responsible for nurturing our children's healthy growth by providing a safe and caring environment. So, how? For example, our research group, the Social Emotional Development Research Group, ZRG at McGill, is tirelessly working on implementing aspects of social emotional learning, SEL, to empower our people to act on. So finally, thank you very much again for your attention and listening.
Hello, everyone. My name is Chad Rose, and I'm an associate professor in the Department of Special Education at the University of Missouri. I'm also the director of the Mizzou Ed Bully Prevention Lab. I'm very disappointed that I couldn't be there with you today, and I was really looking forward to attending this conference, but I'm also looking forward to presenting this content virtually because we are very excited about this project and about the process that we've gone through for implementing a targeted social and communication skills intervention to reduce bullying involvement. So today we're going to be talking a little bit about the next directions that we've taken in the Mizzou Ed Bully Prevention Lab. We're focusing on interventions, specifically skill-based interventions. So I recognize that all of us at this conference are well aware of the definition of bullying. I'm sure that almost every presentation that you've attended has talked about the definition, but I do want to identify the fact that when we explore bullying and we address bullying, we do try to adhere to the definition as laid out here of an imbalance of physical or emotional power, intent to cause physical or emotional harm, and repeated across time or across victims. So when we think about bullying in terms of interventions, these are the things that we are assessing when we're looking at some of our outcomes. Now, we approach our interventions from a social-ecological perspective, meaning that an individual is born with individual characteristics, but they're also influenced by those more complex social and environmental systems that surround them and the interaction of these systems. So first, an individual is influenced by their family, whatever their family structure may be. So their behaviors are learned and developed early on. And then they move into schools. And so at that point in time, their behaviors are influenced by their peer group, their teachers and administrators, and other school-related factors like school climate and culture. Another thing that plays a role in terms of behavioral development and bullying involvement are community factors. We do know bullying topographies are different in different communities. And then also we're influenced by societal factors. Our behaviors are influenced by societal factors as we've shifted and changed over time, where some behaviors have become more acceptable over time, where others have become less acceptable over time. Now, one thing that we've started to explore recently is this idea of social and communication skills as predictors of bullying involvement. And we're going to get into that a little bit here before we get into the intervention. So traditionally, what we used to think about bullying is that there was this pure bully, there was this pure victim, and it was a very linear process. The bully aggressed towards the victim conceded, and it was just very linear. We've seen this depicted in a number of movies and popular culture. And this is how, when I started this 15 years ago, we were conceptualizing bullying as this linear process. But over time, we've learned that our kids are moving in and out of roles based on time and context, as we all do. When we think about how we move in and out of our social roles, depending on where we are and some of the environmental systems that surround us, we respond differently in different social situations. And it's the same with bullying, because bullying is a social construct. So kids are moving in and out of roles based on time and context. Now, one thing that we should note is that there are characteristics that place students at more or less risk. And I spent a good chunk of my career early on exploring some of these predictive and protective factors. And as you see here, a lot of these predictive and protective factors hinge on social and communication skill acquisition and deficits. And so once we started to look at this a few years ago, we started to think, okay, some of our bully prevention efforts have been somewhat underwhelming. Let's think about this differently. And so we started to think about how we can go about teaching kids social and communication skills as a vehicle for reducing bullying involvement. But the other thing that we had to recognize are these identity-related factors and some of the compounded risk associated with some identity-related factors. And throughout my career, I've really focused almost exclusively on this idea of kids with disabilities and disability serving as a risk factor. But the complication with looking at kids with disabilities is that disability falls upon this continuum, and it's relatively complex, meaning that we have to explore the severity of a disability, or even the label of a disability, the characteristics associated with the identification of a disability, where the student is receiving instruction and how they're receiving instruction, what types of services they're receiving. But above it all, what we found is this idea of these compounded risks, right? So as the severity of the disability increased, as the class placement became more restrictive, kids became more at risk. But through it all, we found that those kids that have social and communication skill deficits tend to be involved in bullying more than kids that have age-appropriate social and communication skill, regardless of disability status. But even at that, when we explore disability over time, we see that kids with disabilities tend to be victimized more over time, and that gap really never closes. And it's the same with perpetration. Kids with disabilities tend to be identified as our bully perpetrators, even though I have a much longer talk on how that's a misrepresentation of their behaviors, especially if it's characteristic of their disability. For example, kids with emotional behavior disorders may respond in aggressive ways under normal circumstances, which is a characteristic of their disability, or kids with autism may be engaging in some social or communication skill deficits, and they're using aggressive behavior as a form of communication. So, but regardless, typically we see kids with disabilities overrepresented as bully perpetrators when we do assessments, and we can see that here. So let's get into the intervention that we're going to be talking about today. I don't have a whole heck of a lot of time, but I do want to kind of gloss over some of the important aspects of this intervention. So the main or the central question is this idea: does improving social and communication skills decrease bullying involvement for those identified with social or communication skill deficits? We also have to recognize the nature of skill deficits. So what we're focusing on in our interventions is acquisition deficits and fluency deficits, meaning that we're focusing on those skills that kids don't have and teaching them, or those skills that kids do have but don't reliably use, so we're reinforcing them. And so that's really where we're focusing our intervention efforts, in hopes that they maintain and generalize into other settings. Now, our method here is we did a behavioral risk screener to identify kids with social or communication skill deficits. Then we did a pre-assessment. Then we did 10 weeks of targeted social or communication skill instruction. Then we did a post-assessment. And in our intervention, we were focusing on these 10 critical social skills. These 10 critical social skills tend to be identified in most of the social and communication skill interventions. We find that they're important. We also find that these help improve lifelong outcomes, not just reduce bullying involvement. We used a program called Cool School by Social Express. This is a web-based program, and we found that it was age-appropriate, interactive. The kids tended to like it, and it was geared towards students in grades K through 5. So you can see our demographics here. So our demographics range from, we had some kindergarten students, first grade students, and second grade students that we only had teacher report for. And then a large chunk of our students were in third, fourth, and fifth, and we had teacher and student report for those students. You can see that we had about 4% of our student population have 504 plans, about 10% had IEPs, or individualized education programs. And then a majority of our students who are identified with social or communication skill deficits were in general education. Now, our total sample here in this pilot was 439 students. So what we were doing here is we were doing a repeated measures analysis, and we were measuring these different things. So we had student self-reported measures for kids in grades 3 through 5. And we had teacher reported measures for kids in grades K through 5. And you can see we saw significant increases in pro-social behavior, decreases in victimization, and increases in academic self-efficacy, and increases in pro-social behaviors identified by the teacher, as well as emotion regulation identified by the teacher. And we have that outlined a little bit more here. So these are pre and post on the student reports. So students were reporting that they had increased pro-social behaviors, they had increased academic self-efficacy, and they had decreased victimization. Now, we reverse coded this just to make the graph look a little bit more in line, but that does represent decreases in victimization. Teachers were reporting increases in prosocial behavior, increases in emotional regulation, and increases in academic competence. Our lesson structure essentially followed this basic format. We introduced the skill, we demonstrated the skill, we role-played the skill, we reinforced the skill, and we generalized the skill by communicating with the students' teachers about the skill that we were teaching that day, so they can use behavior-specific praise throughout the week on a specific or given skill. So let's talk a little bit about future directions and recommendations. Now, I don't have time to get into this large multi-tiered system of support framework that we're recommending. But this is typically what we talk to schools about and where we tend to start. So we talk about school-wide climate assessment and behavior risk screeners, universal level bully prevention or social emotional learning programs, targeted social and communication skill programs, and then individualized interventions within the multi-tiered system framework, all while embedding social emotional learning constructs throughout the tiers. But most importantly, what we need to do in our schools is students need to know what to do, what to say, and who to tell. And we have to have a protocol for our teachers in supporting victims, in responding to bullying behavior, and protecting anyone that makes these reports. When we think about skill building, through our interventions, we think about using pre-corrects or prompts, giving kids opportunities to engage in the skill, and using positive specific feedback or behavior specific praise when a student does engage in the skill that we're teaching. But most importantly, what I believe is, I believe that we should be embedding social and communication skill instruction into our daily curriculum, beginning in kindergarten and moving all the way through the lifespan of a student's school career. The reason why I think that, and we've demonstrated that social communication skill interventions and social communication skill acquisition not only increases emotion regulation and academic self-competence, but it also decreases victimization. And so this is a pilot study that we've done. We have since implemented this in a number of schools, and we have data that will be coming out for a second year. Unfortunately, part of our last year of intervention did get interrupted due to COVID. So we are now resuming this instruction. I look forward to being able to present an updated version of this presentation, and with larger numbers and the inclusion of middle school students, hopefully at the next forum. Thank you very much. I appreciate your time. I wish I could be there with you. I'm sure it's a fantastic conference for all of you. Thank you.